Good evening, Bev. Well, it all started in Bangkok's infamous nightclub district, where case numbers spread rapidly from there. So there's some concerning elements to this outbreak. The first is that it is the highly contagious UK variant of COVID-19, which had not been detected in Thailand before. So it's really puzzled health authorities as to how it managed to come out of the hotel quarantine system, given that that is so tight in this country, and then spread into the community through the Bangkok nightclub district. So where people are in an area without masks, they're drinking, they're talking, they're singing, they're laughing. So the disease quickly spread from there. The virus quickly spread from there, I should say. The next thing that really accelerated the spread here, though, was the Songkran Festival, which is the Thai New Year, and there were 3 public holidays in a row in the middle of the week. People took the Monday and Friday off as well, so had a long holiday to go and return to their family for the Thai New Year, as is tradition. And as a result, Bev, the virus has now spread to all 77 provinces around Thailand. It is the worst here in Bangkok. Also, Chiang Mai has had a high number of cases. So it really has spread very, very quickly in just 3 weeks.
What sort of restrictions are being put in place to try and contain the spread?
Well, the Thai Prime Minister Prayut Chan-o-cha has resisted a full lockdown because he doesn't want the economic damage. But, Bev, there might as well be one in many respects. Bangkok is very quiet. The streets are unusually quiet. You can actually cross the road without having to make a mad dash or fear for a car whipping around the corner, or a motorbike or tuk-tuk whipping around the corner. The schools are shut. All restaurants and supermarkets have reduced hours. Bars and entertainment venues have closed, and there is, I guess, a sense from people that they should work from home. The government has certainly encouraged that, though they have not mandated that. So the government, though, says that it doesn't need to implement a full lockdown. It's confident that with its contact tracing and its health volunteers in various villages going around and spreading the word, that it will be able to contain this virus quickly this time. This outbreak is the worst, though, that Thailand has seen, very rapidly spreading and highly contagious.
And Mazoe, you're talking about, of course, how quiet things are. Thailand is so economically dependent on tourism. They had hoping to open up quite soon, but this is obviously going to stymie those plans.
It certainly will, Bev. The plan was initially for Phuket to open in July. They're aiming to vaccinate all adults on the island of Phuket, 70% of the population, before July, so that it can reopen to tourists who are already vaccinated without having to quarantine. But whether or not they can divert all of the necessary vaccines down to Phuket now is a bit of a difficult task, because there are now other areas of need. Healthcare workers right around the country they need the vaccine first, many would say. The government, though, insists that this Phuket plan, this sandbox plan, is still on track, and that it wants to make sure that tourism really can start to come back. It has taken a big hit. This is a country that is reliant on tourism, lots of jobs, not only around the tourist destinations like the islands and the beaches, but also here in Bangkok, up in the mountains in Chiang Mai. This is a country that has been hit hard, not by the virus, but by the lack of tourist dollars. So people are certainly hoping that the government can bring it under control quickly this time.
And of course, in Cambodia, which had done so well as well, they've seen a spike. What's happening there?
Well, about 3 weeks ago, Bev, the cases started to explode there again, and today there are more than 7,000 cases and there have been 54 deaths. It is still one of the world's lowest numbers, though, by comparison, particularly with countries like India. You have to say that Cambodia has done exceptionally well. But they're keen to keep it that way. So what has happened is that certainly in Phnom Penh, they've ordered a 2-week lockdown. People can only leave the house for medical reasons, groceries or work. And that, Bev, is being very strictly enforced. Human rights groups are outraged that police have been caning and arresting some people who have broken the rules. The government, though, has defended those actions, saying that the people didn't listen and that we must take measures to save lives and prevent COVID-19 spreading around Cambodia.
Mazoe Ford, appreciate your time. Thanks so much.
Thanks, Bev.